from a cultural perspective, for whatever reason, when folks have lateral ankle sprains, the common wisdom is to rice it. Okay. So this image I have on the right side of the screen, I apologize if you're listening to this podcast. If you're on YouTube, you're watching the video form of this podcast, you'll be able to see it. But the front page of Google, when you just look up lateral ankle sprain, what is the fastest way to heal a sprained ankle? It says very plainly, rest, ice, compress, and elevate. This is coming from the Mayo Clinic. All right. So usually a source that we can say, yeah, that's good information. And I think parts of the RICE formula, rest, ice, compression, elevation, are good on the early stages after someone has a lateral ankle sprain. But largely, there's no research to support this formula, right? Basically speaking, RICE is more or less wrong. And the ankle joint loves motion after you have a lateral ankle sprain. And this is important to tell your patients because oftentimes they'll read this online or their physician will tell them this. And that's simply not the case, right? So we're going to move this as much as we're able to tolerate. Later on, I'll tell you about which exercise we like to use. And then in terms of, let's say, exercise in the gym or running or any other activity that patients like to do in their free time, we want to try to keep doing this as much as we possibly can, okay? We'll talk about modifications when we need to, but largely we want to keep people exercising. We don't want to stop people from working. We want to keep them going as much as humanly possible early on, okay? So this was important for my patient because she thought that she couldn't do anything. And this was largely coming from her physician, also what she's read. And on top of that, she was so afraid of the injury that she had, just kind of paralyzed by that fear, excuse me. The other thing to educate your patients about is that these things have a tendency to get stiff, right? So if we're not actively working on mobility, they can get too stiff over the course of time. We can lose range of motion. And obviously, that's not good. When I'm doing an evaluation with a patient and they might not have had a lateral ankle sprain, let's say it's any sort of evaluation, and I notice they have stiffness on one-sided ankle, my next question is almost always, have you ever sprained your ankle? And usually the answer is yes. And one of the major reasons why folks have limited mobility in their ankle over the course of time is because they sprained it at one point and never got that range of motion back. Okay. The other thing I like to educate my patients on is basically, hey, you got a lateral ankle sprain. These things feel terrible. They're very scary. What's interesting about them is they tend to make a turnaround very, very quickly. So most folks, the majority of your symptoms are gone by around 2 weeks. Now, this was not the case for my patient because she was here at week 2 and she was still having quite a bit of pain and swelling. However, the problem is that even in the bad ones, the symptoms tend to go away relatively quickly. Most folks tend not to do any form of rehabilitation. And then later on, there's a high recurrence rate, as high as 50%. A lot of folks end up developing chronic ankle instability, future sprains, things get worse. They have more pain, swelling, disability, and this can be a long-term issue. And what's great is that if you actually intervene with a good physical therapy program, you reduce recurrence rates, you reduce the likelihood of chronic ankle instability. So even though these things tend to feel better relatively quickly, we still take them seriously. So step 2 from a treatment perspective is to calm the area down. Now, the way we tend to calm the area down after lateral ankle sprain injury is first to remove anything that's keeping people really swollen, really painful, limping, moving them in a negative way, right? So for our patient, she stopped everything, right? So she's on the opposite end of the spectrum. I actually want to get her moving more because if she does a little bit of easy exercise, easy walking, moves more throughout the course of the day, we know that's going to help her. It's going to help get rid of some of that swelling, get the muscles working a little bit more so, right? But I've certainly had patients, they're in the middle of a sports season, roll their ankle, they go right back to playing afterwards. And I think this is one of the major reasons why folks have a high recurrence rate, because this area is not ready for the level of activity you're throwing at it. You're doing it anyway, just because the sport is more important and for whatever reason. I understand if you're in the middle of a sports season, sometimes like you have to suck it up, I guess, right? But the problem with that is that you're going to lead yourself to longer term problems if you don't address this early on, okay? So at least for the patient today, I just had to educate her on moving more frequently and let her know that motion is good, right? Because if we move a little bit more, it improves our return to sport times, makes us feel a little bit better, improves range of motion, reduces swelling, all that good stuff. So you actually calm the area down by moving more. You need to see the exact exercise I like to use to get these folks out of pain and back to their activities. I have a really good video for you on I'm going to leave a link in the corner. It's my favorite single leg balance exercises for folks after lateral ankle sprain injuries. Definitely go check it out.